If you're in the world today, always wear your mask wherever you're going. Hello and welcome to SW Africa News. This is Global COVID Watch. My name is Peggy Agbe. Today, we will be looking at availability, distribution, and administration of COVID-19 vaccines. I have with me Dr. Emeka Fred Hilary Carnaby. He is our in-house analyst. You're welcome, Doctor.
Thank you, Peggy.
All right, so sit back while we bring you this very interesting prologue. Don't go anywhere. We'll be right back.
When tackling global crises like the coronavirus COVID-19 pandemic, collective responsibility and action are essential. COVID-19, which affects every race, border, and people, affects the world's population and requires affirmative actions by leaders who can significantly impact how well her country responds to the crisis with urgent action. African countries are taking bold steps to curtail the spread of the COVID-19 pandemic by taking delivery of large quantities of the vaccines, with over 5 countries received. With the availability of COVID-19 vaccines, will citizens agree to be immunized, or there will be a need for more sensitization? A popular country music icon is encouraging people to be vaccinated. These and many more we will be looking at shortly.
Welcome back. So, Doctor, the vaccines are here. We have been anticipating.
Yes.
Personally, as a person, I have been anticipating, and I know you have been anticipating. So now that the vaccines are here, are you happy?
I think happiness is relative, you know, because yes, we're glad. I mean, COVID had come to disrupt the whole system.
A lot of activities.
A lot of things, as we know it. Education, every sector was affected. The health sector even more, because of you know, the mortality, even just the cases alone, and isolating people. That took a huge toll on even the health sector. So, is this something to be glad about? Yes, but the journey ahead is so frightening that we just hope that as we move on, you know, as we take the leap of faith step by step, that we can really just overcome what's ahead of us. So we're, yes, glad about this step. Vaccines are in. Not enough doses, but I'm sure we'll come to that.
We have to start from somewhere, actually.
But some is here. We're about to start the rollout. It's actually started, but the journey ahead, I think for me, you know, it just makes you a little somber to see, okay, so where are we going? You know,
okay, so you are happy. I know that. I can see that in your expressions. Do you think the frontliners, I mean the health workers, are they happy about this new development?
Well, again, I would say that this is still relative. Speaking to some colleagues, we're glad that this has come. A vaccine is always welcomed, because what this means is that once we have a critical mass of people who are now vaccinated, there's this, you know, sort of herd immunity, which we spoke about a couple of weeks ago. And so we have decreased transmission, we have a decreased case fatality rate, and that everybody's happy. Eventually, everybody gets to live and live happy. But like I said, with healthcare workers, we always think of the big picture. We, like you mentioned earlier, we're talking about distribution, talking about who gets it, talking about side effects, talking about the bureaucracy that could surround vaccinations, talking about the myths, misconceptions, having to cross that barrier. Countries, you know, economies have to deal with this, ensuring that everybody who needs the vaccine gets the vaccine, you know, and all of that. So, yes, this is the first step. It's a good leap. It's a good thing to start with, but the journey ahead of us is really, really far.
Yes, it is. So now, Nigerians, do you think Nigerians are happy? And then they have fears, you know, taking the vaccines. Do you think there should be more sensitization before, you know, these vaccines are being administered? And if Nigerians have fear, is it real? Are they supposed to be scared?
I think that, thank you so much, Peggy. I think that everyone is entitled to the opinion regarding this, because you can't really work in people's minds. Regarding your question about is sensitization, it's needed more than we could ever imagine. Now is the time. We need to start breaking those barriers, and not just to people in the urban areas, but mostly in the rural areas as well, because there's this perceived fear across all over globally. We're afraid about the vaccines being rolled out too early. We're afraid of the vaccine that has come to countries like countries in Africa. You know, these are vaccines that were not even approved in the United States. And we do respect bodies like the FDA. And so if we're having them say no to a certain vaccine, and like we've always been told, some certain vaccines come, certain things, products, you know, some people even say the Coca-Cola brands that come to Nigeria, you know, the fabric, the telephones that come to Nigeria are usually of a lower grade. So we having a vaccine that was not approved in countries like the United States come to us. What people have their apprehensions about this. So these are things that we need to start debunking. We need to start telling people it's okay. If you are in the category to be the first to receive the vaccines, you need to get them. Because there are also speculations that there are tryouts in the low and middle income countries. You know, are they testing the vaccines? There are a lot of films, articles that have been published that how people do mass, you know, trials, testing trials on people without them knowing that they're actually being. So these are all the myths, misconceptions. Are people going to be monitored after getting the vaccines, you know? And so these need to be debunked for people to accept the vaccines, you know, as should be. I think that's something that, you know, most of the ministries and when it comes to communication needs to be effected at every level. And I think we have to start looking at that. Okay,
talking about the vaccines being here, should we feel some sort of relief, like we're not all gonna die?
You know, I think, you know, on several platforms I've talked about this. We're so lucky. We're so lucky that this disease, this virus was something that we could prevent by basic preventive protocols.
Okay, like the etiquettes?
Yes. These we're so lucky. It says wash your hands, wear a face mask. Thank God it wasn't something that we had to pay for. You know, it was just basic stuff. Thank God it wasn't something that only the rich could access. Yeah. Because it would have been a big issue. So the vaccine coming, and like I've said, and this has been said by a lot of public health specialists, people like Dr. Anthony Fauci would say that this doesn't mean we have to let down our guard. So the vaccine here, it's not a, oh yes, let's all get back to business as usual. It just means that thank God there's something else whilst the critical mass of people are getting vaccinated, that we also have all these protocols. The face mask, hand hygiene, avoiding crowded places. I even hear that they're thinking about lowering these protocols for people who have been fully vaccinated.
Oh, really?
So if Peggy has been fully vaccinated and I've been fully vaccinated, we could gather together. You know, but think about the discriminatory.
Does that make sense?
You know, it technically, but what does it mean if I'm coming for your wedding? I have to come with my vaccination card. You know, so these are some of the things that we have to look at critically, see how effective it is. But these are things that are happening in the world today, and people.
Okay, doctor, we'll be right back. We'll be right back after this short break. Make sure you don't go anywhere.
Information gives you knowledge. Knowledge gives you power. Power helps you to stay alive. At SW African News, we give you that power to stay alive. SW African News. Reliable, authentic, authoritative.
Welcome back. We would be hearing from the other side what is being done. Let's watch this video by Dolly Parton encouraging people to take the vaccine and also taking hers. We'll be back.
So excited. I've been waiting a while. I'm old enough to get it, and I'm smart enough to get it. So I'm very happy that I'm going to get my Moderna shot today. And I wanted to tell everybody, I think you should get out there and do it too. I even changed one of my songs to fit the occasion. It goes, vaccine, 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 vaccine. I'm begging of you, please don't hesitate. Vaccine, 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 vaccine. 'Cause once you're dead, then that's a bit too late. I know I'm trying to be funny now, but I'm dead serious about the vaccine. I think we all want to get back to normal, whatever that is, and that would be a great shot in the arm, wouldn't it, if we could get back to that. But anyhow, I just wanted to encourage everybody, because the sooner we get to feeling better, the sooner we are going to get back to being normal. So I just want to say to all of you cowards out there, don't be such a chicken squat. Get out there and get shot. Anyway, that's my message to you. So I am going to call on my friend, Dr. Najia Boomrod, that's worked in research here at Vanderbilt. That's where I am today. And he's going to pop me in my arm. And so I'm going to call him in. I'm going to mask up first, though, because I have a pretty good distance between me and the camera. So I'm going to try to put this on in line. Okay, here I go. All right. Think you got it?
I got it.
Okay. That didn't hurt. Just stung a little bit, but that was from the alcohol pad, I think.
Yeah.
Right? Okay.
Let me
All
just-
right.
Should we put a...
A Band-Aid? No. Mess up my beauty mark?
Okay.
I'm joking. You do what you gotta do.
Welcome back. So Dr. Dolly Parton actually donated $1 million US to Moderna vaccines, development of COVID-19 vaccines, as part of her contribution to humanity. Do you think that should be done in this part of the world? Should we emulate that?
I think it's a good, I think it's been a thing when there are these public health crises, poverty, hunger in different places. You do have celebrities, philanthropists putting, playing their part, their own quota, donating. In fact, most of the relief funds you see in countries today to reduce hunger, to reduce poverty, gender inequality and all of that, a lot of philanthropists and, most of these business tycoons who donate to these funds, and that's why you have funds and grants coming into lower middle income countries. So it's very much welcomed. It's a good thing. Emulating this, I'm sure, business tycoons in Nigeria would somehow support. I remember that I think I mentioned this on another platform, that once the vaccine comes, there will be other challenges like the needles to administer this. It will be another thing that has to be produced, a lot
well,
of
we
it
can do
and
that
buffer.
here.
Yeah, well, I'm not
Africa
so sure.
can actually-
I'm not so sure about our manufacturing capacity at this
we
point.
we cannot be taking vaccines and also expecting needles.
We
can produce that.
That is where you live, my dear. We live in a country where we need a lot of things to come in, for free at some point. And that was the whole idea of the COVAX, initiative. Ensuring that some of these countries just have it for free, because we're used to that. Drugs for free, health, certain aspects of health for free. So it's a welcomed contribution from business tycoons and people in the diaspora who want to, support the system with gloves, with all these consumables that are needed to safely ensure safely vaccinate people across the country.
Okay, so drawing from this and the fear Nigerians have, do you think that there should be some kind of compulsory rule for every Nigerian to be vaccinated or every African to be vaccinated? Should it be compulsory or voluntary? What do you think?
I think now it's too early to talk about, ensuring that every Nigerian gets the vaccine or everybody in the world gets the vaccine. And this is strictly because of supply.
Okay.
So you also want to ensure that and that's why most countries, not all countries, are giving the vaccine in phases.
Oh.
And this is just because it's not, the amount available is not yet, enough for everybody. So let's vaccinate those who are priority, the elderly, those with comorbidities, frontline workers. In fact, I knowing now that government executives are one of the first people in line to have the vaccine. So until a point comes when this vaccine, we've vaccinated those of priority, and then the vaccine is freely available, is readily available. Remember, we're not just vaccinating children. The dynamics are different when vaccinating children and adults.
Okay.
Because convincing adults to get a vaccine is something
It's
totally
difficult.
different. We all have our ideas and everything,
Yeah.
and all our misconceptions and also our opinions, like I said, and everybody's entitled to one.
Of course.
But it's very essential that we do this right. It's very essential that we follow. Remember, I told you even about storage and everything. Those are all evolving. So it's very important that we follow the science, we follow the direction that the world is going regarding this, and then just take a day at a time and see how things evolve. It's going to really be an exciting ride, Peggy. So I'm looking forward to this and seeing.
I
how
hope I get vaccinated anytime soon.
I don't think you get vaccinated anytime soon.
Okay, some people in other parts of the world are alleging, that they had to pay for vaccines. I mean, should there be charges attached, to be vaccinated?
So we're back to the same thing,
Yeah.
Peggy, because you can't expect to put a fee on getting vaccinated. And make it compulsory. What if I don't have the money? So that is going to go down not so well. I think in these places where people are charged for vaccination are people that want to skip the line. You know how it is. So they're priority people to be vaccinated, but some people are so worried and need to get the vaccine immediately. So I'm not like you, Peggy. You're like down the list. So
Yeah,
if
I
you want the
know.
vaccine now,
I know.
you could be.
Now you
could
keep
be charged.
reminding me
I
that.
keep reminding you so you
maybe
don't
in my
get too
next
excited.
world, I would be a medical doctor. How
Oh,
about
please.
that? So I could be in the front line of things,
You could be in the front line of things, but so for now, charging people who will be charged, I know perhaps a very wealthy man who wants to, be on the safe side, could want this vaccine as soon as possible. And then you could now see, and that's the bureaucracy I'm talking about. You're going to have people shove this into the black market and say, oh, we don't have vaccines anymore, but there'll be some kept for people who can pay for it. And the worst part of this will be that these are free vaccines. We haven't paid for them.
Of course.
They're supposed to be free. And so when you start having this, the corruption creeps in, because it's something that everybody wants. But let us, like I say, I think it's still too early for us in Nigeria. Let us see what the demand for these vaccines will be in the coming months.
So we have 4 million doses
Yes, we
presently.
do.
That's for 2 million people.
Apparently. But we need to look at this critically, because are we going to plan for 2 million people, or are we going to plan for 4 million pending when the next batch comes?
Okay, this first batch that just arrived is
Yeah.
just for 1 dose. I thought it's for.
So that's the thing. So now the countries have to determine. So for example, I'll talk about Ghana because I'm familiar with the dynamics in Ghana.
Okay.
And it's actually one of the first African countries that received the vaccine. They're planning for 600,000 people, and that's the 600,000 doses they got, with the idea that the second batch will come in before people are due for the second.
Okay.
And then there have been speculations. Why don't we have this planned for 300,000 people so that they have their complete doses? But again, we don't know the dynamics yet in Nigeria. Are we planning for 4 million people? Remember, our target is 200 million. So are we planning for 4 million people to get the first dose, whilst we plan that the second batch of vaccines will come and we can vaccinate the 4 million we vaccinated with their second doses? So this is something that they need to look at. We need to watch. We need to observe and say, what is public health-wise? What is more practical? What is more strategic? What will get us to where we need to get to early and on time and doing it the right way?
Okay. So, Doctor, we'll be right back. Let's just go for a short break. Make sure you don't go anywhere. Welcome back. we're still talking about administration and availability and distribution of COVID-19 vaccines present here in Nigeria and in Africa. So, Doctor, from the vaccines available in Nigeria, which is the AstraZeneca Oxford vaccine, it is a 2-shot vaccination. Will the recipients be protected after this while they are waiting, for the next dose? I know we talked about that. Could you throw more light on that?
So basically, remember that the idea of the dosing for the vaccination is on the aspect of how long do I have immunity.
Okay.
So a booster dose is required. For some people, they would say, okay, yeah, in 12 weeks you should have another. Some people will do it in, after a month or so, but at least maximum of 12 weeks. If I'm getting the second dose, it's assumed that now this is the science we're still going to study. How long am I protected for?
Okay.
How long does this keep me from requiring another vaccine? And you do know that there are vaccines that are coming out that they're saying that protection with just 1 dose. So we're all looking at this and seeing how are things evolving. How are things evolving? So I'm protected for the time before I get my second. I'm needing a second dose because of I need that booster to give me immunity to push me further.
Okay.
To give me more antibodies to fight the infection. So we all have to see, okay, if I have the first one, eventually the titers are going to drop, right? Titer, what I mean is the level of antibodies you have will begin to drop after a certain period. And that is why you need a second dose to boost that immunity against the COVID-19 virus.
Okay.
So that's what everybody's doing. So 2 doses are required. But like I said, still, when did these vaccines come?
They just arrived.
They just arrived. So there are a lot of us want answers. Oh, how long? And these are questions that even in developed worlds, we're still trying to understand. Anybody could tell you now, oh, it's 10 years. But remember the vaccines like the yellow fever vaccine, which we now know gives a protection of 10 years. Before we knew that, we had to wait that period to know that these will last that long. So again, this is new. And I think the world right now, everybody wants to be a scientist. Everybody wants to, I know it, with social media, everybody thinks I can understand it. So it's 2 months, so this one, if I take the second one, it should be another 2 months or something. But the science is different. We all have to just keep, and like I said, a lot of Nigerians, what we need to even start thinking about is how many people want to take the vaccine.
Of course.
I think maybe it's something we should look at. Can we do a survey? I don't know if that's
We're on
done.
the streets
Great.
the other day to find out from Nigerians
Yeah.
if they would take the vaccines. And funny enough, some of them said, I would take it to keep me safe. And some said, no, we don't know what the government are planning. We don't want to die and all of that. So I think there needs to be more sensitization for the people.
I think that's critical. I think that we need to work at ensuring that everybody knows about the vaccine. But again, like I said, and I've said this again, trusting your government is another big thing, Why would we trust a government we don't trust with other things? With the vaccine, when they come and tell you that this works. Trust is built like in a relationship.
Yes, of course.
So let's not expect, it's something that we hope for, but let's not expect that because, the vice president took the vaccine, that should just make everybody say, oh my God, it's safe. We're talking about this in the green room, and you had said, do we think that, public figures taking the vaccine? Yes, that's a strategy that has been used all over the world. When you're trying to roll out a new public health strategy, you get on celebrities, you get on public figures,
who people admire.
People admire, footballers, because we love football.
Yeah.
Sportsmen, and they advocate. Even during the COVID-19, launch of different strategies, you'd see that these public figures were put up and said, would you do you stay away from COVID? Do you protect yourself against
stay
COVID?
At home,
stay
if you
at
don't
home.
have the things to do
Exactly.
outside,
And then this was actually a boost for people to believe this was not a hoax.
Okay.
This was real. So we'll just continue.
So doctor, some of the vaccines are actually one-shot doses, just like the Johnson's and Johnson's, though not totally approved by NAFDAC. Okay, why don't we wait for it to come? Why don't Nigerians wait, just to take the 1 dose? Because I would prefer the 1 dose rather than the 2. So do you think we should wait, or we should do with the one we have available right now?
The virus is not waiting. That's what I say. The virus is not waiting. The virus is raging on. Variants are coming up. The death toll, yes, it's going down. The cases, number of new cases going down. Sometimes it just fluctuates. However, we still need to take precaution. I think that this is what we have now. Pending when approvals come of vaccines that we need half dose or no dose at all, let's make do what we have now. What we have now is 2 doses, so let's go for it.
All right. Thank you so much, Doctor, for stopping by. I am more enlightened. Thank you, and hope to see you again.
Thank you, Peggy.
Well, you can watch this program and more on our website, www.swafricanews.com. Email us at securitywatchafrica@gmail.com. And on Facebook, Security Watch Africa, and on Twitter, Security Watch 97. Make sure you follow all the etiquettes of COVID-19 and stay safe till we come your way again. Bye for now.